So we're going to start by talking about what allergies are. An allergy is an overreaction of the immune system to a substance that should not normally cause an immune reaction. Examples include food allergies, asthma, seasonal allergies, or also what's called atopy in dogs. The primary antibody involved is called IgE, or immunoglobulin E. And mast cells and histamine are also involved, particularly with skin allergies and respiratory allergies. So what causes allergies? Well, it's not the weeds, foods, or dust mites that are the real true cause of allergies. Though these are certainly some of the substances to which the immune system can react, the true cause of allergies, this goes for humans as well as animals, is an unbalanced immune system. An unbalanced immune system mounts an inappropriate response to certain stimuli. This will be manifested as various clinical symptoms, including itchiness of skin, which is usually the earliest sign, and this can be manifested in cats as excessive grooming. Itchiness of ears, redness of skin and or ears, especially that of the paws, abdomen, and torso. Eye inflammation and or eye discharge. Anal gland problems or scooting, licking or chewing of paws. Rarely do animals ever exhibit sneezing as a sign of allergies. That's really kind of more of a human symptom. So what leads to an inappropriate immune response? The primary problem that contributes to this inappropriate immune response is over-vaccination. Other things that can contribute include dysbiosis, which is an imbalance of good versus bad GI bacteria. Join us next month to learn more about this and something called microbiome restorative therapy. Contrary to popular belief, it's not food sensitivity and hypersensitivity that are the main contributing factors. These are all secondary to the primary problem, an unbalanced immune system. Therefore, simply avoiding certain foods, while it may help in the short term, will not solve the issue of the overactive immune system. So what about allergy desensitization or avoidance? Similarly, desensitization with small amounts gradually increasing to what's called immune tolerance may appear to solve the problem, but it really does not fix the true issue. They simply mask the problem and cause it to fester and deepen. There's nothing to say that a dog on allergy shots who becomes immune tolerant to whatever's in that allergy shot won't become allergic to other things because their immune system's still out of balance. Again, while avoiding certain foods may help temporarily, it does not solve the true root problem, which is an imbalance of the immune system. So how can we treat allergies? We can treat them using conventional medicine, and this is what conventional doctors do. One medication we can use is antihistamines, and these may work well initially, but they really tend to lose efficacy with time. They work by blocking histamine, hence the name antihistamine, blocking it from binding to and activating inflammatory cells. So they're most effective early in the allergic process because once histamine is released and bound, the chain reaction of inflammation has started. Side effects include drowsiness, dry eyes and dry mouth, increased blood pressure, restlessness, nausea, and dizziness. Steroids. Steroids have pretty significant side effects, including increased thirst and urination, weight gain, upset of the gastrointestinal system, urinary infections, and behavior changes. With long-term use, some animals can even become diabetic on steroids, and they can also harm the liver. Immune modulating medications such as Atopica. These products are very expensive. They need to be continued for life. They take a long time to effect, and side effects include gastrointestinal upset, which is very common, persistent inflammation of the ear, urinary infections, loss of appetite, lethargy, overgrowth of the gingiva, swelling of the lymph nodes. And these also can harm the liver with long-term use. Some of the new drugs include anti-itch medications, such as something called Apoquel. Also, its name is ocleticinib. This medication is also very expensive and getting sometimes difficult to get because it's becoming the conventional go-to drug, since it really does give immediate results because it stops the itch. It, however, does not fix the primary problem. It only controls the symptom. This drug has not been studied or labeled for long-term use. Some short-term side effects include diarrhea, vomiting, and lethargy. This particular drug works by inhibiting a family of cellular signaling enzymes called Janus kinases. And these signaling enzymes, though, are important for the immune system, for red blood cells, white blood cells, and platelets. So when this particular drug is used and these enzymes are inhibited, it can lead to additional immune problems because you're suppressing the body's natural inflammatory response. And long-term use, the side effects are uncertain, but it certainly seems that the immune system can be adversely affected. One dermatologist went so far as to write in an article about this drug that in humans, the side effects include, and I'm paraphrasing for these medical terms, decreased white blood cells, decreased red blood cells, decreased platelets, increased liver values, increased cholesterol, urinary infections, weight gain, and for humans, herpes. And one other article shows that loss of this particular enzyme function has been found to result in severe combined immunodeficiency. Not a drug you really want your dog or cat on. So how else can we treat allergies? We can use topical therapies. Many topical shampoos and treatments exist to help decrease skin inflammation and itching, and they can be very useful. These range from products containing steroids, topical steroids such as hydrocortisone, far fewer adverse effects when we use a topical steroid. Products with something called pramoxine, which tends to sort of numb the skin to dull the itch sensation, to products containing natural substances such as aloe vera and calendula. Some of these can be effective, especially in mild cases. They really don't help that much in severe or long-standing cases, in my experience, because once the itch cycle has been activated for so long, there are very few things that can stop it. The only thing that can permanently stop it and cure allergy is getting to fixing the root cause of the immune imbalance. These products also can be very time-consuming. They can sometimes be difficult, and they need to be repeated frequently, usually 1 to 3 times per week. How else can we treat allergies? We can use Chinese medicine. Acupuncture can help regulate an overactive immune system and help to naturally clear heat or reduce inflammation. Herbal medicine, which works well alongside acupuncture because it can also help clear heat and what they call dispel wind, which means to decrease the itch sensation. However, even though herbal medicine, in my opinion, is far safer than pharmaceuticals, these herbs do work in a manner similar to drugs. They actually do have pharmaceutical effects, and so they really do suppress basically some of the symptoms, and they do need to be continued. There are some other plant-derived pharmacologically active substances, such as certain plant sterols, which may act in a similar manner to corticosteroids, but have much milder side effects. And again, while these methods can be effective, they do need to be repeated and continued indefinitely, typically, to maintain their effect. So how else can we treat allergies? We can use something called microbiome restorative therapy. Since well over 70% of the immune system is located within the gut, if the immune cells of the GI system are out of balance or adversely affected by harmful bacteria or yeast, then the entire patient's immune system will be off balance and will be more likely to overreact to things it shouldn't react to and potentially to be deficient. In humans, science has recently discovered that we actually have more bacterial organisms in our gut than we have the total number of cells in our body. This is literally trillions of organisms. And so join us next month to learn more about microbiome restorative therapy. How else can we treat allergies? We can improve the pet's nutrition, and this is something that we at Natural Pet do that not very many other veterinary practices do. Improving the pet's nutrition is an extremely important and relatively easy thing to do. Most important is to get your pet onto the least processed diet that is possible and practical for you. The ideal diet is going to be raw for most pets, but we never pressure anybody to feed raw. We have plenty of clients that feed cooked diets, whether they're homemade or something such as Fresh Pet. One step slightly higher in processing, but still very unprocessed from raw is freeze-dried raw. Next, we have probably something along the lines of Fresh Pet. Canned diets are a distant, they're better than dry diets, but they're not as ideal as raw or freeze-dried, but they can be acceptable. Canned foods are still subjected to high heat, which can alter and destroy some important nutrients. But whatever form of diet is chosen, it's also important that it begin with real wholesome ingredients. So people need to read labels. Avoid ingredients such as meat meals, which are pre-processed before they go into the food and then get processed again, further destroying important nutrients and rendering them harder for the body to digest and assimilate. This situation can contribute to and or cause something called leaky gut. Sometimes if it's determined that one particular ingredient causes a severe worsening of the patient's symptoms, for instance, I have one patient where the clients noticed that when they eat beef or chicken, their face gets red. Well, we're going to avoid beef or chicken. So if we find that that's the issue, then this ingredient should be avoided for a period. It may be able to be reintroduced later once the true cause of immune balance has been rectified. I could literally go on and on. However, since this isn't a presentation on nutrition, I'm only going to add that home-cooked or completely homemade diets must be nutritionally balanced, especially as it pertains to calcium and phosphorus. Proper species-appropriate nutrition education is one of the things, again, that sets Natural Pet apart from most other veterinary clinics. And in an ideal diet with quality ingredients will cost more. However, over the lifetime of your pet, you will spend far less on medications and illnesses if your pet is on a species-appropriate diet that nature intended for them. How else can we treat allergies? We can use homeopathy. I'm not going to go into a ton about homeopathy since it's not a homeopathy webinar, but join us in June to learn more about homeopathy. So I feel this is the single best method to actually help cure allergic pets. Homeopathy has been in use for well over 200 years. There is a lot of science and observation behind it. It's based upon the theory of like cures like, in that when you administer an extremely dilute amount of a substance that in a healthy patient would cause some of the signs you're seeing in the sick patient, you can elicit a response that tweaks the system to help get things back into balance. Sometimes I think about a balance scale or a musical instrument when I think about homeopathy. Because when we administer the remedy, it's kind of like putting a weight on that left side of the scale to try to help get things back into balance, or turning one of the tuning knobs on the musical instrument. The ideal remedy will help reestablish balance so the body can heal itself without the need for drugs. Drugs can actually prevent remedies from working. Two really, really great things about homeopathy are that the remedies are very easy to administer and there are very few doses needed. Sometimes we only need one dose. And I find this especially useful for cats who are notoriously bad at taking medications. I just want to mention towards the bottom here something called vaccinosis. Vaccinosis is a term for a disease state that is in some way induced or made worse by a vaccination. I personally feel that most, if not all, allergic pets have vaccinosis. We will be covering a lot more in-depth information about homeopathy, including vaccinosis, in our June webinar. So please join us then to learn more about this wonderful, exciting, and gently powerful method of healing. Another way that we can treat allergies is using ozone UV blood therapy. And so ozone and UV treatment induces the release of cellular signals that can help modulate the immune system. So modulate means turn up a deficient system or turn down an overactive system. These signals include interferon gamma and tumor necrosis factor. These treatments can, oh, I just said that. The main methods of treatment involve withdrawing blood and then treating it and administering back to the patient. This is called autohemotherapy, and there are two different ways we can do it. The first is called major, where we withdraw a little bit of a larger amount of blood, we treat it, and then administer it back IV. You see a picture of Pally receiving her blood back by IV infusion here. Or we can withdraw a little bit less blood, still treat it exactly the same way, and then administer it back into the muscle. For more information, you can look into our YouTube recording of the webinar from Ozone and UV blood therapy, and there's the link there. If you want the link emailed to you, just please send us a message and we will shoot it your way. So which of these treatments can be used together? There are some that can and there are some that can't. Antihistamines, steroids, and other conventional treatments can be used with herbal medicine and acupuncture and microbiome therapy and ozone therapy. Homeopathy, however, cannot be used with conventional medicine, herbs, and doesn't typically work very well with acupuncture. But homeopathy can be used together with microbiome therapy or with ozone therapy. So we're going to finish up with top 5 reasons to treat allergies holistically. Reason number 5, homeopathic remedies are very easy to administer and can be very effective when the correct remedy is prescribed. Reason number 4, conventional veterinarians often refuse to admit that things such as vaccination can greatly contribute to a pet's allergy symptoms and will continue to vaccinate allergic pets unnecessarily. Reason number 3, less cost over the lifetime of the patient due to improved health. Reason number 2, potential for an actual cure of the condition, removing the need for continuous medications. And these two guys are really happy because they don't have to take pills every day. The number 1 reason, your pet will actually be healthier as a result of the entire body being treated as a whole due to improved nutrition and assimilation and more balanced functioning of the immune system. And don't forget to join us next month on Tuesday, May 31st to learn more about microbiome restorative therapy. Are there any questions? I should get some background music or something. I feel I don't like the quiet. I see somebody's typing. All right. Sorry. Okay, I'm going to answer the question about allergies and intolerances because I just realized that you guys couldn't hear the answer. The difference is that there are different antibodies involved, and I think you're talking about food intolerances. So I know that it's different antibodies, so it is a bit of a different process, but it still relates again back to the immune system. So, and Kathy's asking about thoughts on allergy testing. Well, there's not a real compelling reason to do allergy testing if you're not going to then pursue desensitization. And desensitization, though, as I mentioned, doesn't really fix the true root problem, which is that unbalanced immune system. So even though you may not see, well, you don't really see immediate results with desensitization anyway. It takes several months, but I feel that it's much better to address the root cause by fixing the imbalanced immune system than to create immune tolerance to 5 or 10 antigens, which is pretty much the most they can put in a desensitization injection. So, okay, what is the preferred method for keeping pets safe from fleas? Well, there are a lot of good products out there. Pretty much we're recommending at this point, if your pet has low risk, there are some natural herbal things that you can do. But if your pet has high risk, there's a product called the Seresto collar that we're pretty big fans of. Kevin's asking, how do you best treat allergies when your dog has degenerative myelopathy? Well, I would stay away from steroids for sure. And I think we might have to talk a little bit more about that because I know you have a special case. Whoa, these guys, Jen, I might need you to help me field some of these. They're coming in pretty quick. Does a dog's immune system also falter as the animal ages? Amy's asking. The immune system certainly changes as we age, but our bodies in general have a harder time, our cells have a harder time repairing themselves as they age because our ability to use oxygen efficiently declines as we age. And I would actually encourage you to maybe tune into that Ozone and UV webinar because I talk a little bit about that to hopefully answer more about that question. Diane is asking how I feel about heartworm medication. We are proponents of every 6 weeks, and we recommend using just the straight HeartGard, which is ivermectin without anything else. Lisa is asking, should you add raw food to dog food, or would it make the meal unbalanced? Oh no, you absolutely can add a pre-made raw to something like Honest Kitchen for sure. All right, whew, that was kind of a whirlwind of questions. If we didn't get to your specific question, you can certainly send us an email. Okay, I see a couple more people typing. All right, well, again, if we didn't get to your okay, can you mix raw food with cooked food? Kevin's asking. Raw food with cooked whole food, I would say, is okay. They're digested at relatively the same rate, and the pH of the stomach required is not too different. I wouldn't feed raw food at the same time as dry food because the pH in the stomach is going to be different for each food. All right, maybe we'll wait just a few more minutes. I want to thank everybody for attending. I hope that you learned some things, and I hope that you'll tell all your friends to attend future webinars and tell them all about holistic allergy treatment because it really is the best. We're not just treating the skin, we're treating the whole patient. Okay, everybody have a good night.